Please rename yourselves so that you can be properly acknowledged. For example, you can put your institutional affiliation followed by your name that you would want to be used. Uh, Secondly, audio and video options are turned off by default. So to ensure uninterrupted streaming, you may close non-essential windows and applications. Our speakers will be given a maximum of 5 minutes to present for each turn, and the question and answer portion will follow shortly after the last speaker. If you have questions, kindly enter them in the Q&A chat. For documentation purposes, this event will be recorded, and if you would like to post about this online event, please use hashtag WDWLF Thank you.
Just a question. This is Boots.
Yes.
Hello.
Yes,
Yeah,
yes.
what's the order of speaking?
You will be the first to speak. First, I will introduce everybody as shortly.
Okay. Hindi papa-booster ko. Ay, sandali. Pa.
Jonathan, can we rehearse your bell? Okay, use your bell. So, and we can, Parma, we can hear it.
Is there an app for the bell?
I use the timer on my phone.
Okay.
Your phone.
Right.
Yung phone ko kasi, yung clock, may timer, ano?
Give me a while.
Hi, Badong. Were you able to use the background Gmail Meet?
Yes. It's very nice. It's I don't. Can you see me? Oh no. Wait. That's strange. Okay.
Cora's in here.
Oh. I don't know why my camera is not working right.
Dazzle, you're muted. Dazzle, you're muted. I can't hear you.
Yeah, I'm not saying anything.
Okay.
Okay.
Nakangiti ka. All right. Should I? Okay. Hindi pa kompleto ang mga guests natin.
No,
But,
si Cora is coming in now.
yeah,
She
okay.
just called me now. So I'll
Yeah, okay.
I'll welcome, and then with Badong and I will introduce the speaker.
Okay.
Badong will Dr. Salvador Eugenio Caoili, and I will be the host for today. No, and Dr. Badong will welcome the audience and our resource persons in the round table, and I will introduce them. Shortly.
Yes. Okay. So, do we allow the
Yeah, we
okay.
can start now.
Nakapasok na sila. Nakapasok na yung mga Isabel Ramos. I'll admit her now.
Okay, maybe we can start 3 minutes while letting people in.
Okay. Let me check my phone. Someone might be contacting me by phone.
So many people are texting me that they can't come in. They registered. I can't
Yeah,
log
okay.
into the Zoom. Kindly send me. What will I
Yeah,
tell them?
even Trina can't seem to come in.
Okay, we'll start in 3 minutes.
Yeah. I don't know why Mayor Trina was asking for a passcode. Wala namang
Yeah, also me,
passcode
there are
yan.
3 people asking me. Okay,
No, kasi, yeah,
Gmail, so we have to move fast. It's already 1
Yes.
o'clock.
The passcode is in the confirmation message that gets sent when you register. So you will receive,
yeah.
or you probably have received an automatic email reply which has the link and also the passcode to use with the link.
Okay, Mayor Trina is coming in. Good morning po, Mayor. I've just made you a co-host.
Thank you. Good afternoon.
Good afternoon po. No, I'm in Manila. I don't know why. Okay. Nakapasok naman na. So we have, yeah, well, I leave it to Roselle and Padong. When to start, we have speakers already in the room. I'm already admitting the waiting room. Ano?
Okay. So we're officially opening our roundtable discussion. I am Professor Roselle Leah K. Rivera from the Department of Women Development Studies, and my co-host, Dr. Badong, Salvador Eugenio Caoili.
Good afternoon, everyone.
So Badong will now officially welcome you.
Yes, welcome to all our esteemed guests, and thank you to everyone who's organized this, and especially to the audience participating in this event today. So to make good use of our time, without further ado, I'd like to hand the floor back over uh, to Dr. Dazzle, Professor Dazzle Rivera, for the introduction of our speakers. Thank you.
So before we introduce our speakers, we are the Interdisciplinary Summer School, now on its 2nd year. This year, we are holding this inaugural roundtable discussion with the theme, what did we learn from COVID? As our overall coordinator for the summer school, Dr. Venaperl Bongolan, there are different ways of answering this question. Most common might be a post-mortem analysis of what was done right, and where can we improve. Another might be to compare and contrast responses from other countries and ours. Again, trying to see where we can improve. As she is an applied mathematician modeling COVID, she can't tell you, joining a chorus from around the world, that she can tell you that reliable data and statistics has been hard to find. So all in all, we don't expect only one person to have the answer. So we are happy and honored to have here today in our roundtable today. I'd like to shortly introduce them all. First, we have Miss Aurora Geotina Garcia, also known as Boots. She's the chairperson of the Philippine Women's Economic Network, or PhilWEN, a consortium of 6 women business organizations advocating to develop and propose initiatives to promote economic and trade activities. And then we have also Major General Edgardo de Leon, who was among the earliest to come. He's now the commander of the 8th Infantry Division, Philippine Army, that has jurisdiction over the entire region 8 or Eastern Visayas with 6 provinces. We have Dr. Virginia Irene de los Reyes-Santos, who practices community medicine and a pediatrician. She will tell us a little more also about herself. No? And we have Miss Cora of Zonta Club of Makati and Environs, or ZCME. For more than 3 decades, Miss Cora has served as president, board of directors, and prime mover of Zonta International initiatives to advance the difficult agenda of gender inequality. We have also Mayor, and we're happy to have Mayor Trina Firmalo Fabic. She's a Filipino politician who is currently serving as mayor of Odiongan, a municipality of Romblon province in Mimaropa region, or region 4B, Philippines. Is Mr. Raymond Basilio, I think, begged off a Pearl?
Yes, I understand. He
Yes.
is in this post, actually.
Okay. Okay, with this, may I call on my co-host, Dr. Badong, to call in the first speaker, Ma'am Boots, Geotina Garcia.
Can I proceed now?
Yes, Ma'am Boots, please. Please
Okay,
go ahead.
thank you. Thank you for the invitation and for the opportunity to sit in this panel, and also for the opportunity to respond to the question that was posed to us. To my view, the COVID-19 pandemic brought the world to its knees and rewritten how societies and supply chains function, leaving women also at the short end of the stick. Globally, there is a consensus that women were either laid off first or are forced to lessen their participation in the marketplace and in the workplace because of increased household responsibilities. As we move towards recovering the new normal, we say time and again that strategic interventions are needed because in order for economies to fully and sustainably recover, women must not be left behind. And in fact, no one must be left behind. To say that the pandemic has disproportionately affected women is an understatement. Inequality persists even in societal and economic impact, as its more and most vulnerable are hit the hardest. Women are most exposed to risks at both health and economic levels. Women make up the majority of frontline workers in care and other professions that involve personal interaction. Women are also overrepresented in precarious employment, including the informal sector, where their benefits and protection are inadequate or lacking. The pandemic has exposed girls and women's disproportionate share of unpaid care and work across the region and around the world. In a report by UN Women, it was observed that while both men and women's unpaid workload increased during the pandemic, women are bearing more of the burden than men. Pre-pandemic, flexible work has been largely associated with women who wanted to become economically and financially empowered, while fulfilling their duties as homemakers, wives, and mothers. Flexible work is a knee-jerk reaction to the crisis, and companies are forced to implement such as a pandemic response. However, the crisis made us realize that flexible work is possible and it is here to stay. In our work, what we wanted also to do is to promote other flexible work options aside from work from home, such as telecommuting, reduced part-time work, compressed work week schedule, and job sharing. So we know what the challenges are. What did we learn from this, and how do we move forward? It is critical to address the disproportionate impact of the crisis on women. Thus, the response must address women's distinct needs, priorities, and solutions. Unlocking women's economic and entrepreneurial potential as part of the recovery efforts can be a force for accelerated and inclusive economic recovery post-pandemic. Solutions must also be explored to identify and develop models for accessible, affordable, and quality care services to meet the needs of families and households as women and men return to work. Women must be engaged as leaders and decision makers in the COVID-19 response and recovery. I cannot emphasize this more. Increasing women's representation and participation is good for society and is good for the economy. In other words, the COVID-19 response and eventual recovery strategy must be gender responsive. To close, the risk of inaction robs people of their time and possible opportunities and puts them at risk in exchange of their safety and overall well-being. It is truly a win-win situation for both equality and inclusive economic growth. Women's concerns must be addressed at all times, not just in times of crisis. So I hope we have imparted ways on how you as students can join and rally to further advocate gender equality and promote diversity and inclusion at home, in the workplace, and in the community. Thank you for your attention and good afternoon to all of you.
Thank you po. You were in time. Salamat po.
Sure.
That's all. Doc Padong.
Thank you very much, Ma'am Boots, for your insights. Trying to capture it in a short 5 minutes. That's a task. And stressing on the caring economy, and how the productive and reproductive work of women. May we now call on Doc Badong. I think he got
Yeah, sorry. My connection isn't as good as it usually is. Can you hear me right now?
yes, we can.
Yes.
Yes. Okay. Thank you very much. So now we'll move on to our next speaker. Our next speaker is Dr. Is it Dr. Irene? I'm sorry. I'm just following you.
General Edgar will be.
I'm sorry. I see. Okay. Yes. Let's now have our next talk by Major General Edgardo de Leon of the Eastern Visayas Command. Sir, General Sir, please proceed with your presentation.
Salamat po. I'll share my screen. Good afternoon, everyone. I intend to share some lessons learned as the security sector implemented the national strategy against pandemic. So at the outset, I would like to make a disclaimer that my presentation is based on my personal account and it should not be quoted as an official statement of any of the organizations, the IATF, COVID Task Force, the AFP, PNP Joint Task Force Shield, or the Armed Forces of the Philippines. And no part of this presentation is classified as confidential. Just want to show you, if you're familiar with this, this is the one that we were tasked initially to enforce, the restrictions of the movement of persons outside of residence. So there were designated APOR. I hope you're still familiar with this. this kind of tasking that were given to us initially, we experienced some resistance, and there were issues by some sectors that the national strategy, or there's no national strategy, and the government response is militarization. So I would like to clarify that we had a national strategy. When the president declared lockdown in March 23, 2020, we were already tasked. The military, the security sector was tasked to come up with a strategy to help the health sector. And the first thing that we did was to study deeply what is the real situation, what is the problem, because we believe that identifying the real problem will help us come up with the correct solution to the problem. So the problem statement that we had initially at that instance in March 2020, the focus of government intervention is on mitigating the social impact of the lockdown. But for the military, which was tasked to come up with a strategy, we went through the process of analyzing deeply what's the problem. So we realized that COVID-19 virus is not the threat per se, because the virus dies naturally without, if it does not a host. No? So the real threat to the public are the infected hosts or the carriers. If they loiter in public places and they are moving around in public areas, they spread the virus. Detected carriers, once put in isolation, no longer pose a threat to the general public. Probably it would be a threat to the confined area. So we realized as well that those close contacts and casual contacts with the carriers are the potential threats, as they are potential carriers, which if they remain undetected are the virus spreaders. So the real problem are the carriers. So they are the real threats to the public. So we came out with a strategy which is carrier-centric strategy. So meron po talagang strategy, hindi po totoong wala. So the carrier-centric strategy, we went through the following phases. So the first phase is to prevent individuals from becoming a carrier. If prevention failed, we need to detect who are the carriers by means of the application of science. Initially, during the initial phase of the pandemic, we only have one laboratory, RITM. So our detection means is only through the use of thermometer. You have to detect kung sino yung may mga lagnat. Then once the potential carriers are detected, they should be isolated so that they would not be spreading the virus. And then once tested positive, they should be sent to the treatment facility. Once treated, they have to be reintegrated back to the community where they belong. So in the process of implementing this strategy, we have determined that socioeconomic intervention should be implemented to mitigate the impact of the interventions. And we considered that it is significant for us to effectively identify, relocate, isolate the carriers through contact tracing and testing. Critical is the protection and survival of the frontliners, particularly the health workers, because pagka naapektuhan sila, magbabag down ang ating health systems. And then the decisive point is the effective reversal of trend in COVID cases. So to implement the strategy, we had this organization. And I would like to highlight the 3 sub-task groups that are the primary responsible for implementing the strategy. The sub-task group on health with DOH as the lead agency, the sub-task group of on law and order with the PNP as the lead agency, participated by the AFP, and the sub-task group on mitigation led by the DSWD and the DILG. We also took this article from McKinsey Company as a reference on how to slowly return to normalcy or to unlock the from the lockdown. So in this article of McKinsey and Company, they showed us the relationship of the speed in the spread of the virus and the public health system readiness. So to recover from a lockdown, the movement should be reducing the rate of the virus spread while we improve the health system readiness. So this is the path that we have to go through from A to B, mandatory lockdown to slow down the virus spread, and B to C, the economy slowly reopens, and C to D, going back to normalcy with the healthcare capacity has expanded effectively.
General, I'm afraid I'll have to cut you short po. Our time is up.
Yeah. So I just want to show some of the challenges that we experience. And for the health sector, for the security sector, this is the challenge that we had for the nationwide enforcement of quarantine, preventing fake news, social unrest, deterrent prevent opportunists, and resistance to propaganda of militarization. So ang nakita namin, what we need to do is we really have to need to change public behavior to adapt the new normal. Law enforcement is not enough because law enforcement is forced obedience. If you're going to look at it, pag nakatalikod, when there's no enforcer, the individuals have the tendency to violate the protocol. So I believe that aside from enforcement, active behavioral change should be undertaken, and we are proposing for the crafting of a comprehensive social marketing plan so that we would be able to implement behavioral change to adapt to the new normal. So yun po yung aming lessons learned, kaya nag-focus po kami lately sa aggressive social marketing and strategic communication so that the people will adapt to the new normal. Thank you very much po.
Thank you. Thank you.
Thank you very much, General. So I think one of the key takeaway messages here is that it all really boils down to human behavior, and if we can organize this in such a way that we have a coherent response behavior-wise, and a key there is really the proper sharing of information without spreading disinformation or misinformation. And with that, I would like to thank the General once again. And now we shall transition to our next talk. Our speaker for our next talk is Dr. Virginia Irene Reyes-Santos, who shall give us a perspective that is focused mainly on health. So, Dr. Santos, are you?
Yes, I'm ready.
Yes. Okay, please proceed. Thank you.
Yes, I have no slides because my narrative is is very long, and 5 minutes is not enough really, But on the ground, I'm a fellow of the diplomate and fellow of the Philippine Pediatric Society, and active in Rotary and in the childhood TB advocacy, and also as a 67-year-old retired doctor, but Rotary, the network of Rotary is very good, and I'm in the field, and there is a long story actually, because there is a referral from the States, from New York, that the intern son of a classmate who is also a graduate of Philippine Science High School, who is a first-year resident in medicine, contracted the the COVID virus, and there's nothing you can do. There was no Plaquenil, and so I had to call a classmate, and he had Plaquenil, and I asked him to send it to him. And so we started, my classmate and me, we treated his son using this at home. He's confined at home, and we did this, and we were monitoring his O2 sat and all that, and we had Plaquenil, we have Tamiflu, because Tamiflu was used for the first COVID epidemic, COVID, the first, because this is COVID-2. This is the second one, coronavirus. The first one was, they used Tamiflu there. So we used Tamiflu, and we used Plaquenil, which is the chlorohydroxyquine, So, but the patient improved. And then after 2 weeks, pinabalik na siya sa trabaho niya. Then afterwards, we gathered together, and then I was getting referrals from classmates and from the and so eventually, nung March na yon, that was February, and March, I was doing telemedicine already with families of classmates in the States here, and I was doing prescriptions, and syempre wala yung dito, so we just gave the Citromax, Cefuroxime, and so and then I was getting patients, and they were dying while nakapila yung kotse sa East Avenue, habang nasa tent ng PGH, they were dying, and that's I might be losing my time, but that's the start of it, and talagang walang gamot, walang problema. And then my classmate, my friend, Dr. Sally Gatchalian, we lost Dr. Gatchalian first, Siya ang una kasi nga she was meeting, and then of course Dr. Hara. And then the patients didn't know also. The doctors don't know also kasi nga we don't know, So tatago nila, umalis silang ganon. So of course there's no information. And then also the is that we were not prepared for this kind of although there was one yung first virus, we had the first experience there, but we did not learn. We were not prepared. And the PPEs, the acquisition of PPE to protect the doctors was not there. The doctors were very good, alam nila, but then, there were no PPEs, there were no protective gears, delayed, there was no organized, and there was, the public health, sector had inadequate and delayed response, So hindi nga, and then the vaccines were also delayed because hindi nila pinipirmahan yung waiver, kasi yung waiver na yon, kasi gusto ng na yung liability absorb ng mag-implement, but yung kasi emergency authority yon, so you do not know what's gonna happen, So those are the things, and then the vaccines, and then I also had to start from scratch how to do the vaccination, kasi dumarating ang Sinovac, wala nang ang Quezon City, wala silang tao kasi pagod na yung kanilang mga tao. So I had to start, and the first, my classmates said, ikaw na, tulungan mo kami dyan sa Xavierville. Mag-organize tayo ng mga doctors dito kasi bibigay lang ng Quezon City is yung gamot, tayo nang bahala kasi wala lang silang tao, and then they're all tired, they're fatigued. So we organized that, and that's good, So I formed a Rotary Vax team, and I had an ambulance, and so we did that. We started that sometime May last year nung dumating ang vaccine. Ang virus dumating was December, and then 2020. Ang vaccines dumating.
1 minute po.
Yeah, okay, sorry. The vaccines arrived in 2021. So you could imagine the delay, and then we were on the ground, and may mga lockdown na talagang serious lockdown. There was no food. So Rotary had to bring in kitchens, dadala ng food yung talagang doon sa mga Payatas, Fairview. Wala silang pagkain, hindi sila makalabas. So we were bringing them 3,000 loads of food, And yun na nga, yung protective gear. Tsaka yung people are not informed kasi wala man lang radio, tsaka sinara nga yung natin, so dapat may radio, and siyempre walang the people should have been guided sa radio, pero yung telemedicine was very good. We were helping families, and they were sharing the prescriptions and all that, Ang problema lang sa Mercury, pinadala mo na ng ang dami-daming humingi dito sa cellphone, gusto pa niya susulat ko. susulat ko, tapos kukunan ko ng picture, tapos bibigyan ng gamot ng patient. And that's really stupid. So I was very angry with that. So anyway, the Citromax helped, at pag may cough, kasi tinapon din yung ivermectin. People were depending on ivermectin, on so tapos eventually hindi rin na-approve yun. Kasi wala nang aasahan ng mga tao eh. So, they were going on ivermectin, plaquenil, so gano'n, no? So kung anong meron, tapos yung mga lagundi, yung mga ganyan on the ground. But people were really, sandali lang. And then of course, the vaccine was, until now, ngayon pa lang inopen yung vaccination to the rest of the population. They were only vaccinating when it arrived. From March to now, ang vaccinations were just for frontliners, for good comorbidity and seniors. This year pa lang inopen yung rest of the population. Could you imagine that? So anyway, I will just answer questions later on. Thank you very much. Thank you for the invitation. Thank you very much, everybody.
Thank you po.
Okay. Thank you, Dr. Santos. So I think the major take-home message is we learned at the start that we were very unprepared for this. I don't know if the general will correct me when I use this analogy, but it was like trying to fight blitzkrieg behind the Maginot Line, or to use very static and antiquated defenses in the face of a very rapidly moving adversary, which was the pandemic itself. And we saw that a lot of the chaos that ensued was really because of this sort of getting caught off guard. So, and now with the vaccines and better surveillance, perhaps we've learned a little more to deal with this kind of thing. So without further ado, again, thank you, Dr. Santos. Let's now move to our next speaker, Mayor Trina Firmalo Fabic Odiongan, who shall give us a perspective mainly from the point of view of local governments. Thank you. Mayor, yes, please proceed. Thank you.
Thank you, sir. Maadong hapon po sa tanan. I'd just like to share my screen. Okay, so from a local government perspective, as you know, when the pandemic hit in March 2020, we were also caught by surprise because the local governments are prepared for typhoons, earthquakes, fires, but nothing like the pandemic. So we were really, in Tagalog, kumakapa. And so what we did, and the lessons that I've learned from COVID, is that, first of all, a timely initial response will set the stage. So we were very aggressive from the start. We already consulted our barangay captains. We called everybody, all the health workers. We already had our checkpoints set up for people coming into the town. So we moved fast. And I think it was very important for us because it set the stage for everything. It set the tone. Also, timely, accurate, and relevant information. This is critical and crucial in terms of crisis management, because when you have timely, accurate, and relevant information, it capacitates your frontliners. People know what they have to do, about what they need to do. It pacified and assured our constituents, reduced anxiety, and prevented the spread of unverified information, which caused people to panic. So this was a very important component of our response to the pandemic. It was that we were able to disseminate information properly. We also made our local government accessible. So we put up text and call hotlines. We had a help desk. We used social media, email, all the possible avenues for people who had questions and concerns to reach us. We made this available and accessible. It was important for us to mobilize different departments and agencies towards a common goal. So we worked with national government agencies, we worked with our different departments and offices, our health office, our engineering office. Everybody played the part. We also carried out strategic planning and collaborative execution. So as I said, it's very important to talk about what you need to do and to do it together. I also learned that people will look to their leaders for assurance and guidance, especially in a time of pandemic. So we had to fulfill that role. And in doing so, we had to be sure that we were non-partisan. So walang puwang ang politika sa panahon ng pandemya. So we made services accessible for everybody. We trained and capacitated our employees and frontliners. This was important. And we also recognized and treated them as human. We were cognizant of their motives, fears, emotions, health, and family. So it's very difficult to demand so much of your health workers if you're not able to support them adequately. So we provided that support. Consistency in policy and implementation is key. So you can't make exceptions for some people. You have to be consistent in implementation so that you are credible and people will follow. You must also empower the community and the private sector. So aside from asking them to follow the rules and adhere to the guidelines, we also tap the private sector and the community. So many individuals and private groups, businesses, establishments, they were able to help us and we provided opportunities for them to do so. So they were able to help us raise funds for PPEs and medical supplies, coordinated meals for frontliners and personnel at checkpoints, meals and supplies for isolated individuals. So they were able to augment our limited resources. And so this was a very important part of our COVID response. But again, trust and transparency are very important because when you're receiving funds, you have to show them where those funds are going to. Interlocal cooperation is also important in the pandemic because we are surrounded by other local governments and other towns. It was important for us to coordinate our COVID response with them and so that we would be consistent with one another in terms of our policies. Also, National IATF, I felt could have been more consultative with the LGUs regarding their policies. So hopefully in the future that will happen. Lack of resources should not restrict us from coming up with creative solutions. So we were able to tap many partners and we were able to use technology to do so. We utilized ICT, fintech, inexpensive tools to adapt to the situation. So we had teleconsult online and other projects as well. We had an e-palengke for our farmers and our vendors, etc. Challenges can be transformed into opportunities. And so moving forward, we've been learning from our lessons. We've started to put more focus on telemedicine, strengthening our mental health programs, enhancing our food production programs because we've seen that food security and self-sufficiency are vital in times of pandemic. We are working on programs to support our micro and small medium enterprises, workers, people who lost their jobs. So economic revitalization. And then we are modifying our comprehensive land use and plans and policies to reflect a mixed-use development strategy that will lessen the need to travel to far distances for work and for living. And harnessing the power of private philanthropy and social capital and cultivating a culture of volunteerism. So I think these are the lessons that we've learned and that we are already carrying out in our policies and programs now. Thank you.
Salamat po. Right on time.
Maraming salamat, Mayor Trina, no, sa sharing mo. At we can see now the range of emotions also which everyone expressed in their presentations, from anger, dismay, and frustration, especially for frontliners, to the presentation of frames of how to approach, no? Two presentations of earlier to the recognition of value of the contribution of the invisible people, no? Especially the vulnerable and the marginalized women. And Mayor Trina also, she stressed also how leadership, no, and putting it in the direction, no, so that constituencies like municipalities and interlocal cooperation would be very important. Maybe Dr. Badong would help also in synthesizing the lessons from COVID.
Yes, so I think it really boils down to uh, the human factor more than anything else. No? I think one common thread has been that it's ultimately human behavior, the actions of individuals, and on a larger scale, our collective actions that largely determine the outcome. No? And this is heavily influenced by uh, factors such as provision of information and also things like disinformation. And I think the most important really is to empower individuals rather than to have some expectation that things will work simply because of some kind of top-down mechanism. It really works best if the individuals are motivated and educated and are, um, operating as at, at full capacity in their, in their abilities to do something positive in such a situation. So
Yes, Dr. Budong,
yes,
maybe we can thank you for your synthesis of the key points and key insights from our speakers. With this, maybe we're now open now to have reactions to specific presentations or some questions for our resource persons. You can put your questions in the chat box or you can raise your hand.
Is Dazzle, may I add something?
Yes.
This is Dr. Santos. Just recently I was donated 10,000 doses of Moderna and 10,000 doses of AstraZeneca, which is expiring on the July 30. Could you imagine? These were because, ang ruling kasi is only to give it to A1 to 4. And recently lang sila nag-approve ng rest of the population, the indigents and the workers, no? So, but then, you have now a 20,000 dose worth 60 million that I have to vaccinate to spread and to finish in 1 month, because this is coming from JG Summit, no? And this is 60,000 and I have to finish it. And sabi ko, dapat nung nilabas yan. Kasi nga, what I'm saying is, because the ruling, the IITF, ang ano nila hanggang A4 pa lang, wala pa yung hanggang seniors pa lang and frontliners. So they should have, kasi nga, the workers are not, tsaka yung seniors lang with comorbidities, hanggang pa lang and frontliners. Pero ang dami nang nag-aabang kasi pag nilabas mo yan ng the rest of the population recently pa lang. Tapos yung pediatric mag-roll out pa lang tayo. But in the US, matagal na siyang approved. Remind you mo, the vaccine was developed at 2020 and we got it 2021. So these are the lessons learned, and then and I'm sure that all of us will be moving forward and but as of today, ang I'm still working sa talagang ang daming very poor, walang trabaho kahit tatanggapin nila at wala sila. And and with the inflation, with the increase in gasoline, talagang we will really need ayuda from government. Thank you.
Thank you, Doc Irene. With that, maybe Ma'am Boots from PhilWEN is raising her hand, and then next we'll have John De Castro.
Yeah, I just want to emphasize that one of the lessons, or maybe one of the observations that we can cite in the way we address the pandemic, was how business sector stepped up immediately. Not as the general had mentioned earlier, there were some challenges in the beginning because we were really addressing a situation which had no playbook. Okay, no one in the world knew how to address this. So I think we need to also give credit to the private sector from stepping up immediately and coming up with their own solutions, not only to address their own employees' concerns, but extended even up to their suppliers, to the communities that they were operating in. So I think that was also quite significant in terms of contributing to shall we say, responding and arresting further deterioration as a result of the pandemic. Second point I'd like to make is that, as I mentioned in my talk, women were really more affected by this situation. And it would have been perhaps more effective, if I might say, if particular concern was given to the issues which were faced by women, which may be distinct from what the men experience. And perhaps that there should have been more women in the committee or in the groups that were crafting the policies. And perhaps private sector should have been part also of the broader committees that were, maybe the IATF. It's part of the direction setting and policy making decisions were being made on this particular issue. That's just what I wanted to add. Thank you.
Maraming salamat sa pagdiin, no, ng kahalagahan ng mga ng private sector, no, at yung keyword dyan is step up, no. So while Mayor Trina was talking about this is the time that wala nang politika, no, and Doc Bodong was also emphasizing that the information, no, would help calm and the public, no, who has no access to information, no. Sige. I think Dr. De Castro is raising his hand.
Maraming salamat, Dazzle. Good afternoon to everybody. Thank you po dun sa ating mga guests. I'm Jong De Castro from the Center for Informatics in the University of San Agustin in Iloilo. My question and my reaction is for all the panelists. I was wondering, because this was a fast-moving epidemic, no? And a lot of us were caught unawares. And I've heard it mentioned many times about information and maybe the lack of information and even fake news. I wanted to understand from our panelists kung ano yung process nila in determining their source of truth during this time. I mean, it really was a very confusing time. And there were so many sources of truth. A lot of them were fake news or disinformation. How was your process in determining the truth in your respective field? So in business or in population, I guess maybe in controlling the population and promoting behavioral change. In the medical field, for example, I heard ivermectin mentioned and hydrochloroquine mentioned, and we know that those are those have been promoted as treatments, but in fact they have been disproven as treatments. And also for the local government, for example, see Mayor Trina, I really appreciate that you had a lot of wonderful solutions to what happened in your local government. But how were you able to, determine what was the truth of what was happening on the ground? And having done that, how were you able to address what was happening? So, yeah, I would love to learn your process in determining your source of truth during the pandemic, because I think it's very important. Thank you so much.
Thank you, Dr. Castro. May I answer first? You know that with the pandemic, you know what is good? Harvard opened up their public health school and online. We're getting online courses, and I got a certificate from Harvard. Number two, my classmates were in Boston and all over in the US, and I was getting information on what's happening there. I'm in touch with all my classmates, and I'm in touch on the ground here. And then also, Tony Liachon is a friend, of course, who is with the ITF. And then also, we had, we know that Ayala, Brazon, and of course the rest, they bought medicine, they bought drugs whenever it was already available, vaccines, and we know, and we are in touch also with the information coming from reliable sources and from CDC. I'm in touch. We are in Rotary is in partner with CDC, Center for Disease Control. And of course, we have conferences with Dr. Salvania, no? and because he's also Philippine Science High School, so we have a network. We have a network of true information, and then also on the ground, we also have first-hand data on the ground, what's happening. So we know we were giving Tamiflu, Citromax, Cefuroxime. We have Montelukast, which helped. And then we also find, of course, the intubation was at first intubation yun, ano? And then there was also hemoperfusion sa hospitals. But yung intubation, di ba, tapos eventually naging proning yon. So we have classmates, may networking kami. May classmates kami kung anong ginagawa sa lung center, may research on molnupiravir ongoing. And then okay na, nag-okay ang molnupiravir. And then we know that, ivermectin talaga nakatulong yan sa iba for parang placebo effect na lang, na they're taking something, no? And also the plaquenil. So eventually naman nag-black market din yan. But as a whole, parang kasi prayerful ang Filipinos, so may resilience sila. So nakatawid tayo dahil ang mga Pilipino, they will suffer and then they are very resilient. So I think that's one. And then yung information, we were getting, ang mga Filipino doctors are really up to date and they know, and I think hindi tayo lacking on true information and correct information on health. Kaya lang hindi tayo protected ng they were tired, hindi na umuwi, the doctors, wala silang PPE, wala silang and then also ang mistake then, they were infecting each other sa donganing and doffing ng mga PPEs, no? So that's one. Thank you.
Okay. Mayor Trina, would you like to share your thoughts next? Please.
Yes. So we used reliable sources. So syempre DOH. I was also looking at CDC. So every night I would read up on the latest. And then of course meron kaming municipal IATF. So we also consult the different sectors. And then of course we look to the national government for issuances. So we would wait for issuances from DILG, from DOH, especially in terms of policy implementation. So we would be guided by that. But aside from that, I really did my own readings, tried to get reliable information, because this was what I would cascade down to stakeholders. So it was very important for me to get proper and reliable information. And how I disseminated that was through social media. Yung kasagsagan talaga ng pandemic, during the height of the pandemic, I would conduct daily live updates on Facebook and other social media platforms, as well as traditional means. May kami yung umiikot. There would be somebody who would do the bandilyo. For those who don't have social media, we would post posters and placards. So it was very important for me to have that right information. And then in terms of the policies of the government, or when there were programs such as those for displaced workers and the like, what we did was that we would interview the relevant agency. We would invite the government personnel to come, and they would be part of our Facebook Live, so that people could get the information right from the source. So this was very effective for us. Our constituents did not panic during the pandemic. We were very clear to them that we would only institute lockdowns as the last resort. So we never did that. So they were very reliant on our daily communication updates. So it was important for me to always look for reliable sources. Thank you.
Thank you, Mayor Trina. Yes, so again, it's been highlighted that reaching out to individual persons so that they can act accordingly of their own will. Yes, that's a very powerful message indeed. Do we have any other panel members? Yes.
Badong, I'm
Professor
curious
Dams.
what the general's process was for, yung kanyang
The intelligence. No?
Yeah.
Yeah. General De Leon, sir, would you care to share any thoughts on the process of gathering intelligence and other information for
I think what I meant was to try to make distinctions between what is true news or true information and fake information, which we know was like, all over the place, particularly in social media, how would I mean, in their experience, how would they make those distinctions?
Yeah, General De Leon, would you care to share your thoughts on that?
Yeah, thank you po. In the security sector, we have a process of validating the information by evaluating the source of the information and the content of the information itself. So we have a category of information. That's why maybe you're familiar with the term A1 information. No? The A refers to the evaluation of the source, and the number 1 pertains to the evaluation of the information itself. So we have such B1, B2, B3 like that. So A1, A2, A3. So the first thing that we do is we look at the source. Sino ba talaga yung source? Is that source reliable? Or that source is a perennial liar? No? So, na-evaluate natin yun. But of course, sometimes yung perennial liar, baka biglang magsabi ng totoo. No? So, we cannot discount the possibility na maaaring totoo rin yung sinasabi niya. So, we need to react or respond to the information. So, ganun po yung aming process.
Okay, Mayor Trina, he put here in the chat box that for her, we only use reliable sources like DOH, CDC, DILG, mainstream news agencies. Thank you very much, General De Leon. Any more? Would anyone want to comment?
Maraming salamat po dun sa speakers natin. I really appreciate your thoughts and your explaining to us the process.
I also have, thank you, John. If nobody else wants to have a follow-up comment on that, there's one question here. I don't know if this was already discussed, but what would the resource persons suggest to put in place if institutionalized so that the lessons from the COVID management are adopted, no? And we could do better next time. Okay. So maybe this would be a good thing to wind up also our roundtable in 1 to 3 words. No, it's difficult to really abbreviate the pandemic, but
It's a
in
challenge
1 to 3
in itself.
yeah. But as a key insight, what would you suggest to put in place in 1 to 3 words, or for it to be institutionalized, so that the lesson of COVID management would be adopted? Okay, maybe we can start first with
I can start.
Yes.
You know, in the private sector, we always have this, what we call a crisis plan, a continuity plan, so that we already anticipate. Of course, in this situation, I think all of us were in the same boat, you know, not although we did have an experience of the previous epidemic. I forget what was the name of that virus?
H1N1?
No, prior to
The SARS one.
the
SARS
first
one.
one, yes. We did have that experience. And I thought that having come from that, which wasn't as bad, we should have already anticipated how we would address similar challenges in the future. I'm not sure, I may be wrong, I'm not sure that we actually have a playbook, as I always say in my talks, that having a playbook helps. It may not be the perfect playbook, but importantly is you anticipate already the possibilities, so that when it does in fact happen, at least you have somewhere to start with.
Thank you very much for that encompassing No. Words. Okay. So continuity plan, that would be 2 words. Can we call now on Mayor Trina, your 2 to 3 words to capture the weight and importance and significance of all your initiatives?
I think they could be institutionalized through ordinances on the local government level, as well as an executive legislative agenda and a comprehensive development plan. So there are many plans for the local government, also the DRRM plans. So the pandemic can already be included in all those different plans. So moving forward.
Okay, so what better way but to craft it in a document, no? Which
Playbook. I call it a playbook.
But from the LGU point of view, you're always thinking about this would be,
Yeah.
there would be a basis that it needs to be enforced.
Yes. For anything to have a budget allocation, it should be in the agenda and the plans.
That's why a plan without a budget is a joke.
Exactly.
So you can only have a budget if you have it in official plan. Yes, General, what are your 1 to 3 words to capture the how
Thank you, ma'am.
lessons?
Ma'am, thank you, ma'am. I fully agree with the need for a contingency plan. Dagdag yung review of existing laws. We have Republic Act 1133-2, which provides for the policies and procedures in addressing the pandemic. So unfortunately, when it was promulgated in 2019, I think the IRR was delayed. So should have been an IRR, and that IRR should have been went through the regular review. Then probably we are more responsive to the pandemic. Thank you, ma'am.
Can I ask a question to the general? Which is related to what he just mentioned. That IRR was probably one of the, missing links, so to speak. Is there a law or regulation which prescribes that IRR should be produced within a certain period of time after a Republic Act is released?
I think so, ma'am. Usually, it is contained in the law itself.
6 months usually.
So the challenge is actually executing it, right?
Yeah. That's why, in the military, kung napapansin niyo, ma'am, we have the regular drill for earthquakes. No? Kung meron din sana tayong regular drill for pandemics, kahit once a year nire-review yung contingency plan for pandemics, and probably we would be responding better.
Yeah, good. I agree.
Okay. Can we now call on, it's now 2:00 and we're on time, no? So maybe we can now have a group picture, and then we would ask Ma'am Pearl to say a few closing remarks. Can we now open our
Take the picture.
okay. Wait, I don't know how. Jimwell, are you there?
Yeah, I use snipping tool, or I don't know how to
Okay.
take a picture.
3, open your screens now. 3, 2, Sir Badong, we want to see you. Next, okay. Okay, thank you. May we
Thank
now
you.
call on the lead person of the summer school to thank our speakers and to close our roundtable today. Pearl?
Yes, thank you. Thank you, Professor Roselle. Nagpapasalamat ako sa ating mga panauhin ngayon. I do appreciate them taking the time and preparing their answers. Nandito yung mga estudyante natin. I hope they were listening as intently as I was, no? Because really, well, we were all busy in our own response. I was busy modeling COVID with my students. That I really wanted to hear from people I haven't, you don't normally hear from. So yes, I appreciate General De Leon all the way from the Visayas, and Mrs. Geotina Garcia representing women in the business sector. And I, of course, appreciate that we were able to get a mayor from a smaller town, because Quezon City has been my study area in my modeling of COVID. And I don't know anything about the smaller towns of this country, which is more representative actually than the bigger cities. So, maraming salamat kay Mayor Trina. And Dr. Irene, I wanted to hear especially from physician outside of course, the government response dahil she would have been on the ground. And so I thank them all very much for preparing their responses and for sharing them with our interns. Maraming salamat po sa inyo. And I think this roundtable has gotten a lot of attention, and we forgot some sectors, and I hope this conversation will continue, no? And try inviting people from other sectors. Salamat po. Good afternoon.
In behalf of the Center for Informatics, University of San Agustin, the Department of Computer Science, UP Diliman, the National Center for Mental Health, and UP Diliman and Department of Women Development Studies, Doc Badong and I thank everyone for coming today. Maraming salamat.
Thank you. Thank you.
Thank
And
you.
good day.
Good
For the
day.
invitation.
Salamat.
I should end the meeting